I would describe how I see a healing space, or when that's actually in action, when we see the increased level of engagement with youth and families.
A mental health system that is focused on equity and justice removes diagnosis as a prerequisite for care, shifts agency and power from providers to beneficiaries, centers the impact of race and class on the health and welfare of young people, and helps young people differentiate what happened to them from their sense of self.
Well, some of the most important mental health supports that helped me coming up as a kid was, one thing for sure was having a mentor. Having a mentor really helped me get through things that were tough for me. So I had a mentor that would come with me and work with me on my schoolwork at school, would take me to outings outside of school. And that really helped me succeed. I really feel like that. And another thing that I think really helped was getting involved in things that I like to do. So if we can take interest in these young kids that are in the foster care system, that's most important.
One of the really important things to think about in our role as supportive adults and in our role as systems leaders is about dismantling the system of power that is known as adultism, which adultism is a belief that older people or adults' perspectives are more valuable or more meaningful or carry more weight than those of young people. And that shows up so much in the way that our systems are set up. That's how young people can keep telling us the things, and then we can keep doing what we've been doing because we just assume that adults know more, know better, that our perspective matters more.
What mental health supports I think I've found most helpful for youth in foster care is really a collaborative approach that includes not just the young person, but their family and extended support network. I think that that's extremely valuable to when we're talking about mental health, that young person isn't navigating that alone or strictly just with professionals.
To me, trauma-informed care is figuring out not just mom and dad, but the whole family in general. So only way we can understand that trauma is to be there and to listen and understand exactly what these families are going through.
From a prevention perspective, we absolutely think that the earlier children can get the support and services they need, and parents are able to help provide developmentally what their children need. We think we'll see less need for higher intensity and interventions in the future.
One thing that wasn't supportive for me in the foster care system when I was coming up was when I was young, they initially put me in therapy. At that particular time, I just wasn't ready for therapy. I had mental things going on, and overall, I just missed. There was other things missing in my life. I wasn't ready to open up to someone that I didn't know.
Another key theme that I think has been really important throughout our work is the role of unresolved trauma in young people's lives. And that's not only trauma that they've experienced themselves, but I really credit some of the young people that we talk to, particularly in the AA and HPI community, for talking about historical and cultural trauma and the ways in which things that have happened generations ago are still impacting young people's mental health today. And the things that we experience collectively, right, are also really big factors in our mental health.
But we also know that young people, particularly young people with system involvement, thrive in relationship to others with lived experience. So an important evolution of the mental health system is to expand the provider class so that we can bring more culturally relevant and culturally concordant providers into our delivery system. This means overtly and directly adding peers, community health workers, behavioral health coaches, doulas, and other unlicensed staff to work on treatment teams that focus on the social and emotional health of children in the child welfare system.
You know, for me, I would like to heal with someone I know or someone I can trust. When we're talking about helping a familiar face or a familiar place where I'm getting care is more important to me than trying to figure out who's going to help me next.
Those with lived experience that can walk alongside youth and families, parent partners, youth partners that are peers and have also navigated the foster care system, behavioral health and mental health systems, and really be a bridge and help to empower and elevate youth and family voice through the process so that families and youth are equal partners, if not leading their mental health services.